She will make sure it's
Great pleasure.
Welcome, everyone. My name is David Howard. I'm a fellow at Kellogg College and one of the co-directors with Carl Hennigan of the Global Centre on Healthcare and Urbanisation. I'm delighted you could join us here this evening, especially when matters of healthcare, urbanisation are probably very much on our minds. We're gathering here as part of the seminar series, a public seminar series set up by the Centre, really to bring to light various urban issues. And the idea is to bring together policymakers, researchers, members of the public, really anyone interested in matters of health and cities. So tonight we're focusing on urban green spaces and well-being. And the World Health Organization estimates that lack of physical activity leads to about 3.3% of global deaths. So lack of regular exercise, lack of access to recreation areas is a significant impact on human mortality and morbidity. So urban design is inherently linked to promoting healthy lifestyles, providing healthy environments. In many ways, that's the core of why the Centre here at Kellogg was set up, to bring together interests and specialisms in urbanisation, sustainable urban development, and evidence-based healthcare. So in some ways, this seminar, I won't say personifies, but resonates very much with some of the core principles and interests of the Centre. So we're focusing today on physical emotional well-being, and it's linked to urban green spaces, green infrastructure. And we're trying to bring together tonight a discussion of what is the evidence for these benefits, and why is that implicit, almost intuitive bringing together of greenness, wealth, or healthiness and sustainable living. I'm personally interested in, and maybe it will come up in the questions later, about that link between the rhetoric and the practice of well-being. I mean, is it something that sort of feathers the sort of already luxury lifestyle of middle classes, and how much does the ideas of well-being really reach the needs of the neediest and the poorest members of society? And that it fitted in, how do we design cities for everyone and provide urban green spaces and green infrastructure for the whole of society? So I'm no expert, but we have 4 experts with us tonight. We have Susie Dunachie, Andy Hong, Peter Neal, and Lucy Shaw. Susie is an associate professor in tropical medicine at the University of Oxford. She is an honorary consultant in tropical medicines and infectious diseases at the University of Oxford Hospitals here, and she's the leader on travel advice, or travel lead. Yeah, there we are. So her early research was done on finding vaccinations for malaria, and she has spent 4 years working in Bangkok in the Mahidol Oxford Tropical Research Unit. Her current research is focused with colleagues in Thailand, India and Bangkok, where again she's developing new vaccines for various tropical diseases. And she also does some research in the impact of diabetes in low and middle income countries. So Susie will be chairing tonight's discussion. And our 3 speakers will be Andy Hong, who's the lead urban health scientist at the George Institute for Global Healthcare here in Oxford. He's also the co-founder of the Healthy Cities Network, which is a network that shares innovative and cutting-edge information about providing state-of-the-art urban healthcare. His disciplines cross and bring together data science, geography, and public health. So he's bringing together an interesting range of backgrounds, and he works primarily or often with civic leaders and policymakers to develop evidence-based solutions. And he particularly promotes physical activity to reduce the environmental burden of diseases, particularly in low-income and marginalised communities. Peter Neal is our second speaker for the evening. He's a landscape architect and an environmental planner. Excuse me, that wasn't a yawn. There's a gasp for air. He specialises in design, funding and management of urban green spaces and public parks. He was a former head of public space at the Commission for Architecture and the Built Environment, and he was design advisor for the Olympic Delivery Authority, which delivered the Queen Elizabeth Olympic Park in London. He's written many reports on public parks for the Heritage Lottery Fund, and has been on government select committees for future of parks. He's also the advisor on the Green Space Commissioner for the Mayor of London. So have busy days. And thirdly, we have Lucy Shaw. She oversees cross-disciplinary, cross-divisional partnerships for Oxford University in terms of their grouping of gardens, libraries and museums. And she also leads on volunteering and public engagement in the university. She's recently developed a new research partnership with Oxford Centre for Evidence-Based Medicine and also runs a cultural leadership programme, particularly working with those within galleries and museums to push forward ideas of leadership amongst those institutions. That's enough for me. I will now gladly hand over to Susie, who will launch a discussion.
Thank you very much, everyone, for coming. Very pleased to see you all today. What we are doing is we're asking each of our speakers to answer the question, are greener cities healthier cities? We've asked them to speak for 10 minutes. We're going to have the main discussion at the end. So after each speaker speaks, if you have any quick burning questions, do ask them. But once all three have spoken, we'll ask all three to have a seat again and please ask questions. So think up your questions as we go. So first of all, very happy to welcome Andy Hong from the George Institute in Oxford.
All right, thank you for the wonderful introduction, and thank you for inviting me here. So good evening. I'm an urban planner by training, and I've been studying green space and well-being, for the past several years, and I'm going to talk about urban green spaces and well-being from the perspective of urban infrastructure planning. So hopefully that will entertain you a little bit tonight. Let's take an example. Let's take a look at this photo, and just a quick show of hand. How many of you think there are some green spaces here? This is not a trick question, just a quick show of hand. How many of you think there are some green spaces? All right, quite a number. Some people didn't, some people don't. Can you actually raise your hand, just maintain? All right, just to see. All right, quite a number of people. So I'm actually curious to know what you think about this photo. This lady here, can you share us why you think there are some green spaces here?
Well, I can see hills in the background, and if I was living there, I would enjoy going up those. It looks like the road, because it's not like a road, would lead out to more open space. It might not, but there is some unbuilt land, and there's trees, and that would feed me.
Okay. Excellent point. So I'd like to hear those of you who didn't raise your hand. Gentleman here, you didn't raise your hand? Anyone who didn't raise your hand? There?
I didn't raise my hand.
You didn't raise your hand? Okay, all right, there you go. Why didn't you raise your hand?
I didn't raise my hand because when I think about urban green spaces, I think about something that's been created purposefully or that has been preserved purposely. And I can't really see particularly from this angle, I can't really see the hills that well in the background. What I can see is a cliff actually right in the corner. Mm-hmm. And yes, it's green, but that's just stuff that's growing. Mm-hmm. They're potentially weeds. Mm-hmm. So yeah, that's why I didn't put my
Excellent point. I mean, those are both valid points. So when we think about green space, we often think of it's a greenery, right? But actually this photo is, I've taken this photo in one of my field visits to informal settlement sites in Cali, Colombia, just a month ago. And during that visit, we asked the residents who lived there how many times they actually visit green spaces nearby. And we expected to get some quantitative answers like once a week, twice a week, and etc. And the answer was like this. When we asked this question, one of the villagers said, "What do you mean by green space? of course in Spanish. We don't have any. It's just the grass. So we had to completely change our question. We really have to rethink how we can understand the basic definition of green space. And green space has lots of different meanings to different people. And especially in places with very little government interventions, like this informal spaces, it is very important to approach this question with very carefully and without having any a priority assumption. So you may ask, why is it so important to understand the different meanings of green spaces? And well, green spaces, generally speaking, we often tend to think that green space provides benefits in terms of ecosystem functions, meaning that some green spaces will actually provide benefits in terms of filtering out toxic air pollution, cool down the land surfaces, and sometimes mitigating a risk of flood. But when it comes to more of a functional aspect of green spaces that you actually mentioned, we really need to understand how people use different green spaces to their benefit. And it requires a deeper understanding of this human-environment interaction, which means that we need to observe people, observe them, how people interact with one another and how people actually use that space for what purposes in that particular context. So for example, we have these two same green fields in these two places. And one on the left obviously have some chairs and nice furniture there. One on the right has some football nets. But essentially, they are the same green fields with some vegetation in it. But intrinsically, we know that these places are meant for different purposes. So, will you be able to play a football in this place? Would that be appropriate?
Yeah, a couple of jumpers, you'll be fine.
Might. Whereas, will you be able to meditate? Will you be able to do some yoga? Maybe, when people are playing football. So as you can see, different green spaces serve different purposes and has very important implications for our health. The one on the left here is obviously more appropriate for social activities. I'm not saying that we can't use it for different purposes, but it's more fit for social activities, relaxation, and etc. And this has implications especially for our mental health and well-being. One on the right is more fit for leisure and recreational activities. It has implications for our physiological health. For example, physical activity, cardiovascular health, cardiometabolic health. So even though these are same fields, green fields, the same green spaces, it serves different purposes and has different implications for our health. So from an urban planning perspective, as I'm coming from my own urban planning background, the way we design and build green spaces can have different purposes for different people and therefore can yield different health outcomes. So this goes to my last point about 3 elements in green spaces in our cities. And I think it comes down to these 3 P's: people, place, and purpose. So our connection to one another is extremely important. And of course, with the global epidemic of coronavirus, we're sort of seeing the downside of strong social connection. But let's not forget that we are also social animals. So, it's, the social connection and the people relationship is one of the most important elements in our health and well-being. Place. is also very, very important. In urban health, we often say that our postcodes matters more than our genetic code. So that means that, our environment has tremendous influence on our health. Whether where we live, where we work, where we play, it really affects our health. The environment shapes us. And lastly, having purpose. If you don't have a purpose in life, and you wake up in the morning, and you know that it's particularly not good for your health. And even if you have a lot of people around you, even if you live in a healthier environment, relatively speaking, if you don't have a meaning in your life, it has a tremendous impact on our health. So I think green space, in a broad sense, is not just a place or a physical infrastructure, but it's something that can connect the dots between people, place, and purpose. And to be able to provide that kind of green space, I think we're far away from understanding what that green space is. And we're sort of scratching the surface in terms of, okay, green space is good for our health. But what types of green spaces? What kinds? In what context? To what people? We don't have the answer to that. So we need to understand how people interact with one another, what people do in that particular context, for what purposes, so that we can design and build our green spaces to promote health and well-being. And again, we have a long journey to get there. So I'm sort of throwing that question again back to you, what that green space would look like. So that ends my presentation. Thank you.
Thank you very much. Do we have any quick questions before the next speaker? No? Okay, so we'll move on. I'm very pleased to welcome Peter Neal, who's come from London this evening to talk to us, to ask the same question.
Thank you very much. Good evening, everybody, and very pleased to be able to join in this debate about greener cities and whether they are healthier cities. So I'm a landscape architect. I have a particular passion for urban public parks, and I am keen to answer this question a bit with a reflection on some of our historic legacy in urban green space planning. So I have rationed myself to just one slide, but I think it's a significant slide. It's Darby Arboretum. It is grade 2 star. It was opened in 1840. And so my point of reference is 180 years ago, but are keen to use that really as a reflection on how we can continue to build greener and healthier cities, because we have been doing it for centuries and doing it pretty well. So Darby Arboretum is one of the most significant public parks in our country, and it was built on land gifted by a local philanthropist, Joseph Strutt, to the people of Derby. And it represents the first publicly owned urban park in England. Now you have, if you're a park history anorak, as I am a bit, you have to then look 7 years on to then look at our first truly public funded park, which was Birkenhead, built in the Wirral in 1847. So there's always this discussion of which is the first public park in the UK. This was the first gifted park, and then Birkenhead is the first park publicly funded. Nuance, but important if you're in the business. And Birkenhead, as many of us probably know, is the inspiration behind perhaps what we could consider our most iconic public park in the world, which is New York Central Park. And it's interesting, at 1847, that's just a year before we then had Public Health Act 1848, in which the government was waking up to the really significant benefits of urban green space and starting to allow local authorities to borrow and raise money to build public parks. But Darby Arboretum is particularly important, for it was located in the birthplace of the Industrial Revolution. The city's silk mill, which is the first factory in the world, was less than a mile to the north of the park. It was designed by John Claudius Loudon, who considered it the most important commission of his career because it combined both complex aesthetic constructs of placemaking and design and landscape, but also some far-reaching social reform. And so even more significantly is the fact that this park heralded the start of the Victorian public park movement, which I think you could consider perhaps one of the greatest legacies of Victorian town planning, and a movement that has made fundamental contribution to the structure, form and urban development practice across the world. So these great urban parks were conceived as an antidote to the social and environmental impact of rapid urbanisation. Vastly overcrowded cities, heavily polluted, with intense levels of poverty. Levels of poverty that were well documented at the time by some of our great writers, including Elizabeth Gaskell and Charles Dickens. Think of Oliver Twist and the like. They are set within this period. And the municipal park movement was driven by four key motives: civic pride, land value, environmental improvement, and public health. And so the Victorians clearly understood that greener cities were healthier cities. And all of these four drivers do continue to provide the motive for some of our most important park building investment across the world today. Be it, say, the creation of the Queen Elizabeth Olympic Park for the London 2012 Games, the High Line in New York, Gardens by the Bay in Singapore, or Centennial Parklands and the Royal Botanic Gardens in Sydney. That is pictured on the flyer for tonight's seminar. So in the words of a research report published by the Centre for Public Health at Liverpool John Moores University in 2007, I suggest it is time we return urban parks to their public health roots. So we now have a vast and growing body of research and evidence that demonstrates that greener cities are healthier cities. And that includes both physical and mental health, but importantly as well, tying that in with environmental health. So where natural systems and services that Andy has made reference to are properly harnessed to improve air quality, moderate peak summer temperatures, reduce the risk of flooding, capture carbon and increase urban biodiversity. These are all things we need to do to ensure our towns and cities are more resilient to the increasing social, environmental and economic challenges that we face. So I suggest that if we are going to return our urban parks to their historic public health roots, we can do this in three ways. Parks and green spaces need the stature and designation of a statutory public service. We now have these challenges that are climate related, our biodiversity crisis, our public health crisis, and public parks are often a Cinderella public service, underfunded, increasingly under-resourced, and it is important that we broaden their terms of reference and role and provide a stronger public health remit. My second point looks at the resourcing of this, and so I also suggest as part of this that parks are partially funded through public health benefits, because at the moment the local authority model of public funding doesn't work. Interestingly, and I come back to Darby Arboretum, when it was opened in September 1840, The Westminster Review re-quoted a comment from the Derby and Chesterfield reporter that said at the opening, "Is it not preposterous, does this not seem incredible that the ratepayers of Derby, through their representatives of the town council, cannot, after receiving this noble gift, vote their own funds on it, £2, £3 or £400 per annum to preserve this property from deterioration and fulfil the intention of the donor. Yet it is so." There was already big and vociferous challenge on how we fund the management of our great public parks. But the difficulty is that these are public services that everyone wants to use, but no one wants to pay for. But we are now understanding through natural capital accounting that we get great public health return. The analysis for London in terms of its natural capital accounts indicated that £950 million per year is provided in avoided health costs through the urban green space of the capital. So we need a blended finance model, and public health budgets, I think, have to be part of that mix. And I finish my third point, that parks need replanning and reprogramming to deliver public and environmental health outcomes that we need in the current financial and social climate. We have to enhance the connectivity to provide greater green networks and greater to deliver natural systems. We have to have much more proactive targeting with investment to improve the active lifestyles that Andy was referencing to. And we have to programme a natural health service programme of activities. So I suggest it is time to revisit our great legacy of Victorian urban parks to ensure that they are empowered and properly resourced to become the engines of community and environmental health and well-being. For this will allow our green cities to be truly healthy cities. Thank you.
Thank you very much. I very much want to visit Darby Arboretum now. Any quick questions? Save them for the end. Okay. And finally, I'd like to very much welcome Lucy Shaw, who is Head of Partnerships and Programmes at our Gardens, Libraries and Museums here in Oxford.
So I'm going to do something slightly different. I'm going to start off by telling you a story, and it's a story that means a lot to me, because it was one of my favourite stories as a child. And I'd love to have read the whole thing to you, but I'm going to just give a bit of a clumsy edit of mine. So apologies to Dr. Zeus. I'm reading you an extract of The Lorax, which was first published way back in 1971. At the far end of town where the grickle grass grows, and the wind smells sour and slow when it blows, and no birds ever sing excepting old crows, is the street of the lifted Lorax. What was the Lorax, and why was it here, and why was it lifted and taken somewhere from the far end of town where the grickle grass grows? The old Onceler still lives there. Ask him, he knows. He'll tell you perhaps if you're willing to pay. It all started way back, such a long, long time back. Way back in the days when the grass was still green and the pond was still wet and the clouds were still clean and the songs of the Swami songs rang out in space. One morning I came to this glorious place and I saw the trees, the truffula trees, the bright coloured tufts of the truffula trees, mile after mile in the fresh morning breeze, and under the trees I saw brown barbar lutes frisking around in their barbar lute suits as they played in the shade and ate truffula fruits. All my life I'd been searching for trees such as these. The touch of their tufts was softer than silk, and they had the sweet smell of fresh buttery milk. I felt a great leaping joy in my heart. I knew what I had to do. I unloaded my cart. In no time at all, I'd built a small shop. Then I chopped down a truffula tree with one chop. And with great skillful skill and with great speedy speed, I took the soft tuft and I knitted a thneed. The instant I'd finished, I heard a gazump. I looked. I saw something pop out of the stump of the tree I'd chopped down. It was sort of a man. Describe him, that's hard. I don't know if I can. He was shortish and oldish and brownish and mossy, and he spoke with a voice that was sharpish and bossy. Mister, he said with a sawdusty sneeze, I am the Lorax. I speak for the trees. I speak for the trees have no tongues. And I'm asking you, sir, at the top of my lungs, he was very upset as he shouted and puffed, what's that thing you've made out of my truffle tuft? Look, Lorax, I said, there's no cause for alarm. I chopped down only one tree. I'm doing no harm. I'm being quite useful. This thing is a thneed. A thneed's a fine something that all people need. It's a shirt, it's a sock, it's a glove, it's a hat. The Lorax said, sir, you're crazy with greed. There is no one on earth who would buy that fool thneed. But the very next minute, I proved he was wrong, for just at that minute, a chap came along and he thought, that thneed I'd knitted was great. He happily bought it for $3.98. I laughed at the Lorax, you poor stupid guy. You can never tell what some people will buy. Then baby, oh baby, how my business did grow. Now chopping one tree at a time was too slow. So I quickly invented my super axe hacker, which whacked off 4 truffle trees at one smacker. And the Lorax, he didn't show up anymore. But the next week, he knocked on my new office door. He snapped, I apologise. I am the Lorax who speaks for the trees. You seem to be chopping as fast as you please, but I'm in charge of the barbar loots who played in the shade in their barbala suits and happily lived eating truffle fruits. Now, thanks to your hacking my trees to the ground, there's not enough truffle of fruit to go round, and my poor barbaloots are all getting crummies because they have no food in their tummies. They love living here, but I can't let them stay. They'll have to find food, and I hope that they may. Good luck, boys, he cried, and he sent them away. I, the onceler, felt sad as I watched them go, but business is business, and business must grow. Then again he came back. I am the Lorax. He coughed and he whiffed. He sneezed and he snarfled and he snuffled. He sniffed. Onceler, he cried with a crufulous croak. Onceler, you're making such smogulous smoke. My poor swummy swongs, they can't sing a note. No one can sing who has smog in his throat. And what you do with this leftover goo, you're glumping the pond where the humming fish hummed. Now no more can they hum, for their gills are all gummed. So I'm sending them off, oh their future is dreary. They'll walk on their fins and get woefully weary in search of some water that isn't so smeary. And then I got mad, I got terribly mad. I yelled at the Lorax, now listen here Dad, all you do is yap and say, bad, 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 bad. And at that very moment, we heard a loud thwack. From outside in the fields came the sickening smack of an axe on a tree, and we heard the tree fall, the very last truffler tree of them all. No more trees, no more thneeds, no more work to be done. Now all that was left was beneath the bad-smelling sky was my big empty factory, the Lorax and I. The Lorax said nothing, he just gave me a glance, just gave me a very sad backward glance as he lifted himself by the seat of his pants. I'll never forget the grim look on his face when he hoisted himself and took leave of this place through a hole in the smog without leaving a trace. And all that the Lorax left here in this mess was a small pile of rocks with one word, unless. Whatever that meant, well, I just couldn't guess. That was a long, long time ago. But each day since that day, I've sat here and worried away. Now that you're here, the word of the Lorax seems perfectly clear. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So catch. He let something fall. It's a truffle seed. It's the last one of all. You're in charge of the last of the truffle seeds, and the truffle trees are what everyone needs. Plant a new truffle, treat it with care, give it clean water and feed it fresh air. Grow a forest, protect it from axes that hack. Then the Lorax and all of his friends may come back. The Lorax Lorax was Dr. Seuss's personal favourite of all of his books, and I think I must have had them all as a child, and this was very much my favourite one too. And he said himself, and he wrote, "The Lorax came out of me being angry. In the Lorax I was out to attack what I think are evil things and let the chips fall where they might." Now, the Lorax came out 9 years after the seminal publication Silent Spring was published in June 1962, and that piece of writing charted the devastating impact of humans on the natural environment. The author, Rachel Carson, was an American marine biologist. She was an author and a conservationist, and her work is credited as advancing the global environmental movement. So Dr. Seuss was feeling really angry about this in the 1970s, and if you've read Rachel Carson's work, you can understand why. So how bizarre that we're still having this conversation now, half a century on. Well, as Peter described in his previous presentation, we've actually been having that conversation and been worrying about it for a lot longer. Now, I don't have the best narrative to give you a great historical summation of the history of parks and well-being, but it's well documented, as Peter started to describe, that in the early 19th century, the growing towns of Britain were characterised by overcrowding, poor housing, bad water and disease. And in 1842, Edwin Chadwick argued that disease was the main reason for poverty, and that preventing disease would reduce poor rates. So actually, he was looking at how they could also save money. You know what these philanthropists and politicians are like. His report, The Sanitary Condition of the Labouring Population, drew attention to the discrepancies between life expectancy of wealthy and poor people in towns and rural areas. And in 1848, a cholera epidemic killed over 50,000 people. It terrified the government into doing something about the prevention of disease through the public and individual health measures, some of which Peter mentioned. And at first the government tried, just as the Romans had done. So we might think we're going back to the 1840s. Actually, we're going back many centuries before then, just as the Romans had done. And the idea that the Romans had also was to prevent illness among the population by sanitation measures. And the first public health measures were based on the idea that miasmas, or bad smells, caused diseases. And although the idea was wrong, the measures against miasmas involved greater focus on cleanliness and healthier environments, and obviously improved public health. And as we heard before the 1840s, there were no public parks in Britain, with the exception actually of London's royal parks, which became public parks with the introduction of the Crown Lands Acts in 1851. Before that, there had been a tradition of pleasure gardens, and that's where we go back to Roman times, because in ancient Rome, gardens were developed by the historian Sallust, and they were then acquired by the Roman Emperor Tiberius for public use. And many public gardens, public pleasure gardens, also opened all over the world. And in this country, I live in London, and the Vauxhall pleasure gardens feature very much so in the stories told in museums such as the Museum of London. And these places were open to the public for recreation and entertainment, but they were venues for entertainment and included attractions such as concert halls, bandstands, amusement zoos and menageries. And so as the towns and cities began encroaching on fields and urban populations found themselves increasingly divorced from the natural world and its physical and psychological benefits, campaigners such as Chadwick and also politicians like Peel perceived the negative implications of this urbanisation. So it's a conversation we as humans have been having for a very long time. And we can also thank the Victorians for preservation of common land as well, and commons. And common land is distinguished from parks by being open access and relatively wild and remote. The concept of common land originated with the Normans in the 11th century. And as populations increased in the 19th century and more land was enclosed, the Parliament Act of 1866 protected urban spaces such as Hampstead Heath and Wimbledon Common that we still use today. So these green spaces are integral to our social, intellectual and environmental infrastructure, and they testify to us as humans, to our needs and desires. The park that hosted cricket matches in the 1890s may continue to do so, but it might also be used now for running, yoga, stretching, reading, meditation. And here in Oxford, we've got our university parks, and from my perspective, working for the gardens, libraries and museums, we've got the university's incredible botanic garden and Harcourt Arboretum. And they're very central to the GLAM division, and they're very central to a big programme of work that we're undertaking now around health and well-being of our staff, our students, and also our many different publics. And we want to better understand natural capital and the role our venues can play as community-based social prescribing assets. And social prescribing recognises that people's health and well-being are influenced by a variety of factors, many of them non-medical. Supporting social prescribing policy is a high priority for the UK government, and by 2023-4, NHS England has pledged that at least 900,000 people will be referred to social prescribing. So, GLAM, the Gardens, Libraries and Museums, we've been lucky enough to form an amazing partnership with the Nuffield Department of Primary Healthcare Sciences and its Centre for Evidence-Based Medicine, which is also supported by Kellogg College. And we're exploring ways in which natural capital and indeed arts and culture can contribute to people's health and well-being. We want our GLAM spaces to be spaces for social prescribing, and we want to build an evidence base so that investment can be maximised locally and so that others can learn from our work. The opportunity to bring the health and heritage sectors together in this way within an academic environment is really unique, and we're able to bring together world-class clinicians with some of the best heritage professionals, cultural and horticultural, in the world. And we also have great members of the public that we work with, like Jean, who's the most amazing woman who participates in some of our activities for older people. We have an older people's action team. And Jean has spoken for us at events not hugely dissimilar from this, and we asked her to say, you know, how do the museums and the gardens contribute to your well-being? And she sort of stood there and said, well, they're absolutely everything to me. They mean everything to my health and well-being. And she hadn't thought about this concept, social prescribing, but when we began to explore it with her, she and many of her friends who come to the groups that she comes to realised that that's exactly what they were doing. They were supporting their health and well-being. So I want to end my presentation by stating my belief that the natural environment and the crisis it faces is inextricably linked to our health and well-being as humans, and that the crisis in healthcare continues to face with population increase and continual urban expansion. You cannot improve one without addressing the other. And I also have 3 Ps. My Ps are people, place and planet. So I've replaced purpose with planet. And I'm wondering, you know, is it a crisis of our time now? Or is this actually a crisis that we, of humans, have been having to try and wrap our heads around psychologically for many, many more centuries, but perhaps now it seems ever more urgent because of increased urbanisation and particularly the environmental damage that we see around us. And with this in mind, my final quote is going to come from Moth Snowstorm, which was published in 2016 and that my colleague Emma Webster sent me this week. And in it, Michael McCarthy wrote, "I believe the innate bond with the natural world is at the very heart of what it means to be human, that the natural world where we evolved is no mere neutral background, but at the deepest psychological level, it remains our home, with all the intense emotional attachment which that implies, passionate feelings of belonging, of yearning and of love. On the surface, in our everyday lives, this bond is largely invisible. It's very generally unfelt, as it's not only been overlain by the 500 years of generations of culture which followed the conquering of nature by farmers, but for those of us who live in towns and cities in an increasingly hyperactive age, it's buried under the impenetrable mass of urban mental clutter. Yet deep down, it is there. We may have left the natural world, but the natural world has not left us.
Thank you very much. So we've had several themes running through all three talks. The idea that this isn't a new issue that's been going back since Roman times and before. We've heard about the importance of remembering the environment as well. And I'm going to start by asking each of you, you've been put in charge of designing a new park in a city. So some wasteland's been cleared. It's been given to you to design it. I want to ask each of you, what's the one most important thing about your design to improve human health? Andy.
Well, I like the fact that you bring in planet. I think when it comes to health, we have to think about not only just the ecological function of green spaces, but also the purpose, the actual functional aspect of green space. So just like the example that I showed you in the photo, some people may just feel like it's just grass. What can I do about it? I mean, it may have some benefits in terms of ecological function, but if you don't have any purpose to do anything in there, it's not going to do a lot of benefits. So we can actually maximize the benefits of green space by actually putting any kinds of purposes. So not only just the physical environment, the designing aspect, I think a lot more focus has to be put on the actual programming aspect. What can we do with this space? So I think not just the design, but also designing of place. How can we actually activate the place for our health and well-being?
Great, thank you very much. And Peter, what would your most important thing be?
My observation is that the most important thing to do, I would say, in approaching the design of a new urban park is to understand the needs of the community that that park is serving. And that's an interesting exercise, and I'll illustrate it through personal, professional work. I've been doing a park strategy, which I completed last year with a colleague, for the London Borough of Barking and Dagenham. Highest levels of childhood obesity, I think, in the country, certainly in London. And you look at the catchment that individual parks serve in terms of particularly public health and childhood health needs, and you program those green spaces to meet those needs in collaboration with those that you're designing to serve.
So how would you do that? What feature would you put in the park for these obese children?
Well, there is increasing drive for promoting more active lifestyles, and some of the mechanisms are straightforward in terms of enhancing access, enhancing movement, provision, both physical as well as mental engagement with the natural environment. And I will give another example of how one could address that through North Haller Fields. It's on the A40. I work with Peter Fink. If you drive out of London towards Heathrow, you go past 3 conical hills that were created by the London Borough of Ealing. Those were a mechanism to create a new park for Ealing for free, because underneath those hills are the old Wembley Stadium and White City. And so it was a mechanism to recycle land and waste building materials, but to create a topography that it is physically interesting to engage with, i.e. you've got to walk up to the top of, but spiritually enlightening, because there are many who use those parks for enlightenment as you go to the top of those hills to cast your eyes across London from Canary Wharf to seeing the planes taking off from Heathrow. And so you work with topography and you work with the setting to create an active and healthy park, but one that is mentally active as well as physically active. Loudon worked with the topography here in Darby Arboretum. It is a sophisticated shaping of landform to set you apart in a landscape oasis from what was very intense urban degradation. So you work with topography. There's one technique that you can use.
Thank you. And Lucy?
Well, I'm really pleased that I know what those hills are now after all of the times I've been stuck in traffic jams on the A40 wondering. I'm going to use the example actually of the High Line, which you also mentioned, Peter, because that's one of my favourite urban spaces. And I love the High Line because it's reusing an old railway line that cuts across a certain section of New York. It's very near one of my favourite art galleries, the Whitney. And it's great because it combines really interesting planting, it's somewhere to walk and talk, there's really interesting art. So for someone like me who loves art and culture, it's just fantastic. But I noted down when you asked that question, I wrote down inclusion, because I do think it's really important to consult and talk to people when you're designing things. So, for example, this programme that I described, the social prescribing programme that we're creating within the gardens, libraries and museums, the social prescribing, the thing that's prescribed, we want to design with members of the public, people who'll be using it, so it will be something that they want to do in our gardens or in our museum spaces. So I think that's really important.
Thank you. So, do we have any questions from the floor? Carl?
Yeah, a lot of really interesting stuff, and I guess when Peter said it, you sort of said Victorian times, we sort of got the need for parks because of all the sort of problems that was going on and the issues. But what we've seen in the last 3 to 5 and maybe in the last 10 years, an erosion of funding, and we've seen areas completely cutting funding. Because I guess what they've done is say it's easy to get rid of that funding. So it's great to see what's happened in Derby, but across the board, we've seen a reduction in funding. So what would it take to focus the mind, do you think, to say, how do we reinvest in these spaces? And it's a worthwhile use of some of the public money to do this. Because I think that's part of what we need to think about, and our job is to try and create what's the particular issues that we think it is worth investing for the council X million to do more of these spaces.
Thank you. So who would like to come in on that? What do we have to do to bring in the funding?
I've got something to say, but do you want to go first?
No,
Go for it, Lucy.
Okay. So just from an Oxfordshire perspective, the county council, as you know, there's lots of building going on in places like Bicester, building new homes. And I know from talking to colleagues within culture, within the county council, that they're also talking to colleagues in planning about, as well as working with developers to put up new homes that meet various different criteria, they also think about the cultural and outdoor spaces that are built into that environment as well at the same time. And that includes libraries and parks. So I think it just has to be within sort of the mentality of local authorities to understand. And my feeling is that actually that there is a growing understanding of how important it is to have spaces for people to go because of natural capital, for example, and cultural capital, and economics that are coming out of places like the Surrey Business School down the road. They have a centre for wellbeing research that is looking at, what makes people happier and how, if people are happier economically, it will be better. So that sort of economic modelling has been done, so we can make that case to councils.
Thank you.
Yeah.
Did you have anything to come in?
Well, I do, but let's open this discussion up. I'll chip in a minute.
Well, I was going to choose something if it's okay.
Great, yes.
Just to say that, just to pick up on Pete's point about trying to find out what people want and what would work for them. I've just been doing some work with the Elds Development Corporation this week, training about how you might use charrette methods, design-based engagement, intensive engagement methods to help sort out things like parks, open space, blue-green networks. And I think Pete's absolutely right about how important it is to work with communities, with stakeholders to define the nature of the kind of places that they want. And Bicester, I mean, you know, badged as a garden town, you know, we're in this era now where we, in theory, are going to have a whole series of new garden settlements. Some practical ones coming through now. And I think they are a really interesting and useful and important setting for us to be working on all this, because they ought to be exemplar projects. I think the work that the NHS Healthy New Towns project, which focus on some new towns and some garden city examples, shows some possibilities. And I know Pete's actually personally involved in some work at Letchworth Garden City, where I'm the director of their institute, their Garden City Institute. And you know, so we do have some real possibilities to model fantastic practice. You know, just as Darby did, you know, the Arboretum, as you said, retrieving the Victorian, that glory of public infrastructure. You know, find a new golden age of public infrastructure using garden new town settlements as one of the examples. I think that'd be great. So a comment really rather than a question.
Thank you.
I don't mind.
No, that's great. Thank you very much.
I'll follow on. So infrastructure, green infrastructure in this case. The infrastructure word is as apparent today in our budget that I haven't really heard much about, but I know it's one of the key tenets and foundations of the budget, is how we fund this infrastructure, because public parks provide public benefit for the public good, but the public's skint. And so how you then actually find those mechanisms to properly resource a landscape that needs to be managed as much as it needs to be built. And so it's the conundrum of capital and revenue funding that is rarely addressed. And I think the question sort of sets this, it puts its finger on the real challenge. And I took that quote from the opening of Darby Arboretum, where they said, you know, Derby must be nuts for taking on this great gift of a wonderful new park, but they're going to have to pay to look after it in perpetuity forever. And so I think the challenge on getting our greener cities and healthier cities working properly is to look at how we properly resource that long-term management in a way that is different to the current model, because the current funding model does not work. I could continue on, but someone's waving at the back.
I've got a question waiting here.
No, I mustn't
If I
take your role over.
If I may comment one, so I think there's actually a structural problem from more of a larger framework. So if you look at the UK in the green space policy, there's a sort of a gap in the middle. So there's a top level, federal level policy through NPPF, National Planning Policy Framework, that sort of drives sort of these investments in green spaces. And I don't think there's any like the middleman that connects between the federal policy that channels down to the local level. The local level, you know, the local agencies are sort of struggling to maintain their the green spaces, existing green spaces, let alone trying to invest in new green spaces. So I think that structurally there is a gap. Compared to other countries like Germany, who has more of a middle sort of a regional level planning, the agencies that sort of handles the national policy and how that channels to local government. And another issue I think that's sort of being addressed in some of these efforts is to try to really to bring out the benefits, to try to internalize the externalities that we have not been able to measure and to really calculate in terms of the economic framework. There's some fascinating work in that regard, but I think we have a long way to go trying to really bring in the benefits of green space, not only just in terms of economic, ecological function, but also the functional aspects, especially when it comes to mental health aspect. I think we're missing the huge benefits when it comes to economic costing. So I think those two, being able to address the structural problems. Is there any, the incentives for the local governments, and also trying to really internalize the externalities that we have been missing?
Thank you. We've had a very patient questioner here.
Thank you very much, everybody. Really, really interesting. There's been very different and interesting perspectives. And my question is probably more a comment again, but absolutely what everybody else has been saying. How do do you deliver it? And it's the delivering of it. I think we've got a pretty good idea of what we need. I agree with very much the purpose, your point about purpose, which is one aspect is sort of housing for the elderly, always shoves them in apartments and flats without any garden. And that's when you've got time to garden. It gives people a purpose, particularly it's useful for elderly. But the main point I guess, is there was an article in The Guardian a couple of days ago, I think, about who actually influences decisions, planning decisions. And it is, of course, the House Builders Federation, 40% is influenced by them. I'm sitting on a design review panel at the moment on a garden village, and it's the house builders that are going to be driving that. No matter how good the philosophy is behind providing public spaces, it's going to come down to the person in homes who regulate, and they just want boxes out, box with 2.5 car parking spaces, tiny patch of land, and the elderly are going flats. So how do we actually make it work? How do we get the policy that will actually have teeth? Because the National Planning Policy Framework, the revised one, I haven't seen, I know, but it actually, if you look closely, says anybody can build anything, anywhere.
So the house builders have too much influence and they get their own way ultimately. Would anyone like to come in on this?
Well, I guess not from more small, mom and pop sort of developers, but like larger firms like Arab, engineering firms are actually realizing all the benefits of green spaces. They're actually putting a lot of money on evaluating the effects of green roofs, for example, and they're actually experimenting different types of green infrastructure as part of their building development and also as part of their community. So if you see a lot of new developments that's coming, relatively larger development, you see that they're trying to incorporate all these green space elements. And that's because it's, one, driven by demands. A lot of people want gardens, a lot of people want green roofs. And two, is actually, from a developer's point of view, the ROI, return on investments, is actually, it makes sense from their, the investment point of view. So I can't really comment on, more of a house level development, but at least, larger space, larger developers, they're actually taking into account on some of these benefits.
Thank you. And did you want to come back on that?
I did actually. I hope you don't mind me having a second bite of the cherry. Just that, I completely take your point about this, but I think Letchworth Garden City, of course, has got land value capture because it managed, despite everything, to retain that, and it now has a charitable trust. It's legislated that that land value capture is in there. So that long-term stewardship issue, the money that goes into the town through its rents and ownership of land, of property and so on, goes back into doing things like maintaining parks and gardens, and so it puts them in a much better position. Somewhere like Ebbsfleet, which is a development corporation, has the powers of a development corporation, so they have got more levers to pull. And I think you can see how, since they came in 2015, how there's been a dramatic and increasingly improvement in the placemaking from the kind of, developer-led approaches. And then, of course, there are individual developers, like in my area in Hertfordshire, I work, where Gascoigne and Cecil, the legacy-driven developers, often aristocrats, care about places because their family's been hanging around for hundreds of years and hanging around for hundreds more. And so they really want to make things work in a long-term way. So their proposals for garden villages, garden towns, new towns, flipping places Duke of Fife and South Aberdeen, and they are doing something I think that's much, much better. So there are, I think, examples which stick out as kind of different from what you pointed out. But to go back to Pete's funding model, I think we get more land value capture back into the way that we look at infrastructure. We would have, I think, much better chance of doing the kinds of really fantastic things that have been suggested tonight, and in practice, and balance up the power of the cartel of house builders we have in this country.
I know we've got a couple of other questions, but I agree entirely that relationship between development and landscape, park making and town making is incredibly intrinsic, yin and yang. If I looked at Birkenhead, it would have been a much better model in certain ways, because that was a real estate development process, as Nash did with Princess Regent for Regent's Park, where the development funded the park, funded the development, funded the park. They were intrinsically linked, and we've severed that to our detriment. And I think that is where some of the solution on this funding model will sit, if we re-establish that relationship between land and property value directly with landscape park making, but also park managing. It has real potential and reassurance from the models that we see through the garden cities, but also when you look internationally with, say, Minneapolis, with all their parks funded through a property tax. It's not perfect, but it has been established for over 100 years. You go to Melbourne with a parks charge that looks at utilities, water management, but funds botanic gardens and the zoos and the like. The relationship between property value and park management is incredibly important, and we must not sever that, because you then get all those multiple benefits that flow from that.
Thank you. We have a question here.
I'm just picking up on Peter's point about funding, and you articulated in Derby this tension between the public and the private, and right from the beginning. I don't know Derby, but I've been involved in Birkenhead Park in the early 90s, where an oil company put in £150,000 to repair the Chinese bridge and the pavilion, all that stuff. We haven't really talked about that, with philanthropy is an additional funding stream that comes in, and has been, well, certainly for Birkenhead, right from the day one, right until the 18, whatever it is, Birkenhead started 10 years ago. Is that something that's replicated in Derby, or is it Derby just that economic situation not applicable to Derby, but it might be applicable to London, or how do you see that kind of that more philanthropic input into these particular areas? Is that an unusual funding angle, Peter, or not?
No, it's not. I made reference to a blended finance model, because I think our public parks just being public funded didn't work from day one here, and we've always been trying to make it work. Unless you are blessed to live in Milton Keynes with a Milton Keynes Parks Trust that is funded through an endowment that has grown over decades, so that is a self-funded model, and there are a range of self-funded management models, principally through endowment, across the world that work, and that is really reassuring. But I think the simple summary, which I had explained to me from Central Park, was that parks need some core public funding, and a third from public funding, a third from earned income in terms of the services and the activities that they provide, and a third from philanthropic and voluntary contributions. Gives you a very initial summary of this blended finance model. And to be slightly provocative today, was perhaps our public health budgets also need to chip in, along with our utilities who manage water, and along with a range of other public services that benefit from that, and those that benefit need to pay.
Thank you. So, do we have a final question? Thank you.
Interesting. I come from Preston, actually, Lancashire, where we have the old historic town municipal parks, and I was brought up in those things where, you go rolling eggs at Easter time in the park, as everybody does. I worry a bit about Oxford, because we got the university sort of funding things, we've got the city trying to fund things. We have a whole lot of private people, like the two golf clubs, for example, the North Oxford Golf Club and the other golf club in the town, with a nice group of old chaps pushing the ball around, and huge areas of space, which we've got to do something about, and the demand is really for affordable housing. And I'm not sure how we're going to get that balance between public and private when it comes to funding the open space that's really needed.
Lucy, would you like to comment?
Gosh, that's a difficult one, because public housing is a really serious issue in Oxford. And I don't live in Oxford, I actually live in Hertfordshire. And my understanding is that Central Oxford is one of the most expensive places to live in England, but I'm happy to be corrected if I've got that wrong. Where I live, people say it's Gerrard's Cross, but there you go. People are always going to quibble, aren't they? So there is that tension. But what I would say, because there is the City Council at the moment is developing a new strategic plan that's called Vibrant Active Oxford. And what they're trying to do is break down silos across different bits of the City Council. And I hope I'm not doing them an injustice here, but I've taken part in some of the workshops that they've run. So they've brought cultural partners, people like me. They've had people who work in different parts of the City Council across different disciplines, talking to one another, thinking about how can we make people's lives more active, how can we improve their health and well-being and enjoyment in the city. You know, what do people need? And they're looking at needs of people, from people who are homeless to people who are in receipt of benefits, right the way through to the guys on the golf course pushing the ball around. And it's a really, really difficult thing to have to juggle, because there is that pressure for building more affordable housing. But I would say they're very mindful of wanting to have a very active, healthy city. And so they are taking that very seriously. And I think the county are as well, but they are limited by the funding that they have. So this idea of a blended model and finding a way of enabling local authorities to do that well would be fantastic. So in Derby, for example, I know the silk mill very well, and I know Hannah Fox, who's done lots of the work around bringing in sort of human-centred design to recreating the silk mill, which is part of Derby Museums. And the museums were owned by Derby City Council, and they became a trust. I can't remember how many years ago now. And basically every year there's been more and more of a crisis for that group of museums, because they have a grant from the City Council, which knows that it needs, they need a bit of public funding, but ultimately they want that money to stop, and they just want it to be a not-for-profit, albeit, but they want it to raise its own money, and doing that commercially and philanthropically in our sector is really, really hard outside of London. It's very hard to generate philanthropic funding.
Okay, thank you. I think we're going to have to bring this to a close, but please come up and talk further to our speakers, because I feel like we've only just got started. So I'd like to thank our three speakers very much indeed for this evening, and thank you for your participation and all your questions. And do come up and talk to them. Thank you.